cardiovascular system. Question number 1. Why is it important to manually assess pulse rate? Options: A. Amplitude, volume and irregularities cannot be detected using automated electronic methods. B. Tachycardia cannot be detected using automated electronic methods. C. Bradycardia cannot be detected using automated electronic methods. D. It is more reassuring to the patient. Answer A. Amplitude, volume and irregularities cannot be detected using automated electronic methods. Question number 2. A patient on your ward complains that her heart is racing and you find that the pulse is too fast to manually palpate. What would your actions be? A. Shout for help and run to collect the crash trolley. B. Ask the patient to calm down and check her most recent set of bloods and fluid balance. C. A full set of observations: blood pressure, respiratory rate, oxygen saturation and temperature. It is essential to perform a 12-lead ECG. The patient should then be reviewed by the doctor. D. Check baseline observation and refer to the cardiology team. Answer C. A full set of observations: blood pressure, respiratory rate, oxygen saturation and temperature. It is essential to perform a 12-lead ECG. The patient should then be reviewed by the doctor. Question number 3. Where is the common aneurysms locations for the elderly? Options: A. Abdominal, B. Hepatic, C. Renal, D. Loop of Willis. Answer A. Abdominal. Question number 4. The most commonly aneurysms can develop on. Options: A. Abdominal aorta, B. Circle of Willis, C. Intraparenchymal aneurysms, D. Capillary aneurysms. Answer A. Abdominal aorta. Question number 5. Which of the following is the most common aneurysm site? A. Hepatic artery, B. Abdominal aorta, C. Renal arch, D. Circle of Willis. Answer B. Abdominal aorta. Question number 6. Which sign or symptom is a key indication of progressive arterial insufficiency? Options: A. Edema, B. Hyperpigmentation of the skin, C. Pain, D. Cyanosis. Answer C. Pain. Question number 7. What is the most common complication of venipuncture? A. Nerve injury, B. Arterial puncture, C. Hematoma, D. Fainting. Answer C. Hematoma. Question number 8. Why are anti-embolic stockings an effective means of reducing the potential of developing a deep vein thrombosis? Options: A. They promote arterial blood flow, B. They promote venous blood flow, C. They reduce the risk of post-operative swelling, D. They promote lymphatic fluid flow and drainage. Answer B. They promote venous blood flow. Question number 9. Why are support stockings used? A. To help relieve the pain and discomfort, to promote venous flow, C. To prevent new varicose veins from appearing, D. For cosmetic reasons. Answer B. To promote venous flow. Question number 10. In DVT, TED stocking affects circulation by. Options: A. Increasing blood flow velocity in the legs by compression of deep venous system, B. Decreasing blood flow velocity in legs by compression of the deep venous system. Answer A. Increasing blood flow velocity in the legs by compression of the deep venous system. Question number 11. We are looking after a 75-year-old woman who had an abdominal hysterectomy 2 days ago. What would you do to reduce the risk of her developing a deep vein thrombosis? A. Give regular analgesia to ensure she has adequate pain relief so she can mobilize as soon as possible. Advise her not to cross her legs. B. Make sure that she is fitted with the properly fitting and embolic stockings and that are removed daily. C. Ensure that she is wearing anti-embolic stockings and that she is prescribed prophylactic anticoagulation and is doing hourly limb exercises. D. Give adequate analgesia so she can mobilize to the chair with assistance. Give subcutaneous low molecular weight heparin as prescribed. Make sure that she is wearing anabolic stockings. Answer D. Give adequate analgesia so she can mobilize to the chair with assistance. Give subcutaneous low molecular weight heparin as prescribed. Make sure that she is wearing anabolic stockings. Question number 12. Early sign of phlebitis would include A. Slight pain and redness. B. Increased WBC. C. Pyrexia. D. Swelling. Answer A. Slight pain and redness. Question number 13. The patient manifests phlebitis in his IV site. What must a nurse do? Options: A. Resite the cannula. B. Inform the doctor. C. Apply warm compress. D. Discontinue infusion. Answer D. Discontinue infusion. Question number 14. You have observed an IV catheter insertion site with erythema, swelling, pain and warmth. What is the best nursing action for this insertion site? A. Start antibiotics. B. Resite cannula. C. Call doctor. D. Elevate. Answer B. Resite cannula. Question number 15. The early signs of phlebitis include A. Redness and pain at site. B. Increase in temperature. C. Swelling of surrounding tissue. D. Resistance when administering intravenous fluid and drug. Answer A. Redness and pain at site. Question number 16. You have observed an IV catheter insertion site with erythema, swelling, pain and warmth. What VIP score would you document on his notes? Options: A. 5, B. 2, C. 3, D. 4. Answer B. 2. Question number 17. What is the best way to avoid a hematoma forming when undertaking venipuncture? Options: A. Tap the vein hard, which will get the vein up, especially if the patient has fragile venous. This will avoid bruising afterwards. B. It is unavoidable and an acceptable consequence of the procedure. This should be explained and documented in the patient's notes. C. Choosing a soft bouncy veins that refills when depressed and is easily detected, and advising the patient to keep their arms straight whilst firm pressure is applied. D. Apply pressure to the vein early before the needle is removed. Then get the patient to bend the arm at a right angle whilst applying firm pressure. Answer C. Choosing a soft bouncy vein that refills when depressed and is easily detected, and advising the patient to keep their arms straight whilst firm pressure is applied. Question number 18. Cause of hypotension in elderly. A. Decreased response in adrenaline and or noradrenaline. B. Atheuroma changes in vessel walls. C. Hyperglycemia. D. Lack of exercise. Answer A. Decreased response in adrenaline and or noradrenaline. Question number 9. Which is not a cause of postural hypotension? A. The time of day. B. Lack of exercise. C. Temperature. D. Recent food intake. Answer B. Lack of exercise. Question number 20. When would an orthostatic blood pressure measurement be indicated? A. If the patient has a recent history of pulse. B. If the patient has a history of dizziness or syncope on changing position. C. If the patient has a history of hypertension. D. If the patient has a history of hypotension. Answer B. If the patient has a history of dizziness or syncope on changing position. Question number 21. What do the adverse effects of hypotension include? A. Decreased conscious level, reduced blood flow to vital organs and renal failure. B. The patient could become confused and not know who they are. C. Decreased conscious level, oliguria and reduced coronary blood flow. D. Patient feeling very cold. Answer C. Decreased conscious level, oliguria and reduced coronary blood flow. Question number 22. Orthostatic hypotension is diagnosed if the systolic blood pressure drops by how many mmHg? A 20, B 25, C 30, D 35. Answer A 20. Question number 23. Conditions producing orthostatic hypotension in the elderly. Options: A. Aortic stenosis, B. Arrhythmias, C. Diabetes, D. Pernicious anemia, E. Advanced heart failure, F. All of the above. Answer: F. All of the above. Question number 24. Signs of hypovolemic shock would include all except A. Restlessness, anxiety or confusion, B. Shallow respiratory rate becoming weak, C. Rising pulse rate, D. Low urine output of less than 5 ml per kg per hour, E. Pallor and later sweating. Answer: B. Shallow respiratory rate becoming weak. 25. The following are signs and symptoms of hypovolemic shock except A. Confusion, B. Rapid heart rate, C. Strong pulse, D. Decreased blood pressure. Answer D. Strong pulse. Question number 26. Signs and symptoms of early fluid volume deficit except A. Decreased urine output, B. Decreased pulse rate, C. Concentrated urine, D. Decreased skin turgor. Answer B. Decreased pulse rate. Question number 27. What do you expect to manifest with fluid volume deficit? Options: A. Low pulse, low BP, B. High pulse, high BP, C. High pulse, low BP, D. Low pulse, high BP. Answer: C. High pulse, low BP. Question number 28. What are the signs and symptoms of shock during early stage 1 to 3? Options: A. Hypoxemia, B. Tachycardia and hyperventilation, C. Hypotension, D. Acidosis. Answer B. Tachycardia and hyperventilation. Question number 29. Severe bleeding is best characterized by A. Moist skin and pinkish nail buds, B. Dry skin and pinkish nail buds, C. Moist skin and bluish nail buds, D. Dry skin and bluish nail buds. Answer C. Moist skin and bluish nail buds. 30. The following are ways to assess a patient's fluid and electrolyte status except A. Pulse, blood pressure, capillary, rectal and jugular venous pressure, B. Presence of pulmonary or peripheral edema, C. Presence of postural hypertension, D. Biomarkers. Answer D. Biomarkers. Thank you for watching this video. Please like, share and subscribe for more videos.